Okay, it looks like we have quite a few folks on the call, so we'll go ahead and get started. Good morning and welcome and thank you for joining us this morning for St. Joseph Health Community Partnership Fund virtual open house. The Community Partnership Fund, or as we often refer to the fund, was launched in 1986 as a strategy of our founding sisters to ensure all of our healthcare ministries have an ongoing, sustainable, and continued vehicle to dedicate dollars and resources in serving the poor and vulnerable within our communities. I've had the privilege of serving in Northern California for over 35 years and have seen firsthand the impact the fund has had in our areas of Humboldt, Sonoma, and Napa counties. Over the years, the fund has employed evidence-based strategies and engaged with innovative upstream organizations such as the Prevention Institute to launch multi-year grants that foster collaboration, improve the quality of life in at-risk neighborhoods, and develop community-based infrastructures addressing health inequities. So now I will turn this over, and it is an honor and a pleasure to welcome you this morning and to introduce Gabriela Robles, the Chief Executive for the St. Joseph Health Community Partnership Fund. Thank you, Gabby.
Thank you, Dana, and good morning, Northern California. We're so excited to be here today. And I also want to thank Martha Shanahan in Humboldt County and Dan Sherman in Sonoma County. As Dana has shared with you, we've always had an amazing partnership within the system with our community health investment leads and also with all of you. And it's really nice to recognize some names and see some of you on the screen. So thank you for your time. And so for today, it's really not that, for some of you it might be new, but we really want to introduce the fund, provide you with a little bit of a history, as Dana shared with you. The fund has been in existence for 34 years. And so we'll be sharing with you what has been happening throughout those years as we share with you what the fund has been doing in action. And then we'll be sharing with you our expansion now that we're part of Providence St. Joseph Health, providing you with a little bit of information about what will be our focus areas and what will our footprint look like. And most importantly is really discussing and working with you and partnering with you as part of today's session and looking forward to our partnership into the future. And as part of our tradition, before we get started, we're going to start with a reflection. And this is Sister Suzanne Sassis, the founder of the fund. And we'll start there and then we'll get going. Thank you.
At the heart of Catholic healthcare is the healing ministry of Jesus, taking care of the neighbor without distinction, taking care of the poor. St. Joseph Health has been doing care for the poor and community benefits since its inception and before its inception. But we didn't do it because of government regulations. We're doing it because it's the heart, it's the purpose for which we're in healthcare. St. Joseph Foundation, as it was originally called when it was founded in 1986, was founded at the request of the sisters who had said to our first CEO, how are we going to continue taking care of the poor? We're in this ministry. It is a ministry as well as a business. And the purpose of the ministry is to continue the healing ministry of Jesus. And if you go to the scriptures, you see that Jesus took care of everyone. He took care of them body, mind, and spirit. And that has caused us to do the best we can and to evolve as we saw the needs evolving. When we formed our health system, our fear was that our new leaders, who we irreverently then called the suits, because they were mostly men, might not understand how important all that was for us. So we said to our first CEO, how will you assure us that we can continue to take care of the economically poor? The Community Partnership Fund has been a way of expressing, of continuing our legacy of caring. I see the Partnership Fund as being the vehicle that's going to take our legacy of caring for the dear neighbor into the future. I've especially been proud of the systemic change that we've been able to bring about by developing communities, by empowering community leaders. That has brought whole neighborhoods and whole areas to a different level of well-being so that we can keep people well and keep them out of the hospitals. Everything in healthcare is changing. And if we are to continue what we call Catholic healthcare, there has got to go through all that change, the constant of the mission. I hope we all at St. Joseph Health and now Providence St. Joseph carry on this legacy of caring, which is also the legacy of the Sisters of Providence, by continuing to find structures, policies, and programs that will give stability to this aspect of our mission that can move into the future. The hope I hold and the vision I hold is that in the midst of the constant changing and evolution of healthcare, we will remain faithful to caring for the dear neighbor who is close or who is stranger, body, mind, and spirit, continuing to extend the healing ministry of Jesus.
Thank you. We're very fortunate that Sister Suzanne is now a member of the board of the fund. And so the vision that she had in the beginning in 1986 continues for all of us. And, 1986, the fund was founded by the Sisters of St. Joseph. And now that we've joined with Providence as Providence St. Joseph Health, we have the opportunity to honor the legacy of the Sisters of St. Joseph of Orange and the Sisters of Providence. And that is where we see the opportunity to continue to serve and address in partnership the issues that impact the lives of the economically poor, those communities that we serve throughout the system. Next slide, please. And as you can see, it's our mission statement. And even within the mission statement, the second part, we do provide the funding and support to improve the health and well-being of the economically poor, but truly in partnership where we seek to utilize the strengths and the diversity of our neighbors to build vibrant communities. And so we don't really focus on only the needs, but really recognize the assets, the lived experiences, the skills, and the vision of all the communities that we serve, and in partnership with all of you. So this is who we are. Next slide, please. And so now that we've come together, we've got our leadership team, myself, Jason Laxamana, who's our Senior Program Officer, Alisa Barrios, who oversees our grants management systems. We also have Carrie Shonwall and Teresa Beard on our team. Next, please. And the fund, now that we are part of Providence St. Joseph Health, sits under what we call community partnerships. And you can see here on the slide, we also have community health investment. So Dana and her team also sits within community partnerships. An opportunity that we have is the opportunity to collaborate. So we've got philanthropy, education, government affairs, global and domestic engagement, and the fund. And so the work that we do within community partnerships, within Providence St. Joseph Health, is really external looking and how we can best engage in the communities and tap into all of these resources and assets that we have within the division and within the organization. Next, please. Just to give you a sense of our new footprint. So initially, pre-expansion, the fund really was present in Northern California and Southern California. Now we're present in 7 different states, 7 regions. As you can see, it extends from Alaska, Washington, Oregon, Montana, Texas, and New Mexico. And within Southern California, it also includes Los Angeles. So it used to just be high desert, Orange County. So now Southern California also includes LA County. So you can see the opportunities that we see in partnering with so many organizations and so many communities and continuing to have that impact that we started here in Northern California and Southern California. Next, please. And then for today, for Northern California, I just wanted to highlight the hospital ministries that we have starting in Humboldt County, in Sonoma County, and Napa County. So these are the communities that we have served and we continue to serve. So very excited that we continue on this journey together. Next slide, please. And so now Jason will share with you a little bit about what we do and what the work has been so far. Thank you, Jason. Okay, so I'll start. I think Jason might be having some technical challenges. And so what we do,
I'm here now.
Go ahead, Jason. Thank
Looks
you.
like we're not really good with the mute button, apparently. So thank you all again for making time this morning. We would have loved to have been up there with you doing multiple open houses, actual open houses where we have some cookies and coffee and strawberries and stuff. But unfortunately, the world turned a bit and we're doing everything virtually right now. So while it is virtual, we're with you in spirit, and we will be up there fairly soon, I hope, working side by side with many of you, as we've always done. So what we do, and it's not any different, I think, from the folks who have already been working with us. It is strategic grant making. And what does that mean? It looks at how we align with Providence St. Joseph Health, the health system. We are an independent foundation, but we are linked and aligned with the health system. So we work closely with our colleagues like Dana and Dan and Martha, as well as other members of the health system, to leverage impact, to look and share resources and identify common opportunities. We develop strategies that not only about the need at hand, but how does the impact continue beyond the funding, such that we're looking at a larger, bigger, more impactful projects. This is really an important piece for us, looking at innovation, looking at community impact, looking at community innovations together, and how we can support what's going on in the community, but also elevate that to sharing it across the field. And really looking at supporting our communities, not just in new things, but what you're already doing. There's a motto, an informal motto that we have in some of our initiatives. It's meeting the community where they're at. And that means managing expectations. It means looking at what structures are built or haven't been built, and then marking progress based on those conditions. So it may look different in different places. It will look different in a rural community than it looks in an urban community. It'll look different maybe in Humboldt than it does in Napa or Sonoma or in Southern California. It's all part of specificity of opportunity and specificity of resources in those communities. So grants and funding, yes, but it's much more. I do want to refer back to something that was said earlier with our mission, that all we do is focused on improving the quality of life for the most vulnerable and marginalized in our community. It's really in our name, the community, partnerships, and really authentic partnerships at that, and fund, but not just monies and not just grant awards, but much more than that. It's about partnership. It's about, in some ways, struggling together, building together. So in the spirit of that, idea, we have a bit of a poll to ask and some questions from the poll to ask you. Again, we had hoped to do this in person. We were imagining some breakout tables and everyone would talk and meet and we'd get to know you a little better. But through the wonders of modern technology, we're able to kind of do that through some questions here. And at this time, I want to introduce Paul Bonfante, who is a consultant coordinator for us, who's helping manage this this session, but also will talk through a bit of the poll. I'll turn it to Paul for a little bit.
So hello, everybody. I've just launched a poll. There are 4 questions. They should be appearing on your screen. Some of you who are dialing in from phone may not be able to see this. We apologize for that. But there are 4 questions. You can scroll down to answer each of them. Just to get, as Jason says, to get a sense of who is in the room. Again, if you're not able to see this poll, we will be doing breakout sessions a little bit, so we'll be sure to capture who you are. So we will take about couple minutes for everybody to have a chance to select this, and then we will review the results.
And again, this is just the way, by answering these 4 questions, it's a quick snapshot of who's participating in this call. We have over 100 participants. That's amazing. We're so excited to see partners, old friends, as well as new friends and hopefully new relationships to be made. As I said, it's strategic grant making, but we also don't view ourselves as a traditional grant maker. I think we believe in order for us to address the needs in the community, it takes these partnerships. It takes authentic conversations and co-strategizing together. This poll is a way for us to see who's on the call, who we could work with, who wants to work with us, the different issues, and the geographies that are engaged in. You know, we take all this information. I think at the very least, we are stewards of the resources from the foundation, and we look to not waste anything, even a poll. So we're going to use this to help us understand who's out there, where we need to be. You'll hear a little bit more about our initiatives and some new initiatives that are rolling out this year, but then we're also in the midst of finalizing strategy for some newer initiatives that will be rolling out in 2021. And every touch point that we have through this poll, through the breakout sessions, through the one-on-one conversations that we'll have with folks, all will be integrated into that sensing. So it sounds like we may be close to completion of the poll, Paul?
Yes, yes. So it looks like we're tapering off. We'll give it maybe 5 more seconds for people who are just finishing. All right, so we're going to end the poll and share the results now. So everyone should now be able to view the results.
I do want to also point out a little bit, there may be questions that come up, other ideas, other suggestions. Please use the chat. I already see there's a lot of activity in the chat. That's great. We'll read everything. We'll incorporate that. Yes, Mendocino is missing. Sorry about that. I think it can be incorporated in there. We know you're there. We haven't forgotten you. And if there's other questions, other points that you think are important for us to know, please use the chat. I think, unfortunately, because it is virtual, we may not be able to have a round robin question and answer period, but we will have time to answer some questions that are in the chat later on in this Zoom call. So it looks like we have some folks who are familiar with us, a lot of folks who aren't. So great, welcome. We hope to learn more about you, and hope this is useful for you to learn about us. We have groups that are run the gamut across different community issues, different, not just health issues, but overarching determinant factors of wellness. Obviously, housing and homelessness is a huge issue across all communities, and that is something that we hope to tackle. in other initiatives that we have too. Looks like we have folks who are focused across the age spectrum, across folks who are working on different issues and different populations, and it just speaks to the diversity, not just of need, but the diversity of resources and the passions that everyone has on this call. And again, there's quite a bit of folks from across the three general service areas of Providence St. Joseph Health in Northern California. I know that Sonoma, there's a lot of folks in Sonoma, but you know, the county size is a bit bigger than Napa and Humboldt. So if we adjust, there may be some number adjusting, and we might see much more representation that's equal across population size. So thank you for participating in the poll. Again, we'll continue to look at this data. So if we go to our next slide and share a bit of our strategic framework. For some of you, again, this is not anything new, but it's a good refresher, especially in this day and age, that we do, while we are a health funder, we also focus on the upstream. And knowing this term has been used a lot in the last few years, social determinants of health. We'll get into that in a bit. We have a focus and a goal of equity, and it's not just health equity, but just equity. We'll get into that in a couple slides. We are intentionally collaborative. We want to work, we need to work together with diverse partnerships, with different folks, maybe with different points of view, but coming together. That's the only way we're going to get to a solution. We're responsive to community needs and opportunities. We're not just in some boardroom trying to figure out strategies, but really listening and co-designing with community members and community stakeholders. And innovation. We want to be innovative. We need to be innovative. If the answers were already determined, we would have already gone there. So we need some new solutions and some new strategies. These are our pillars. They guide our strategy. They inform our strategy. The ideas here, being upstream, being collaborative, focus on community and innovation, all of those leading to equity. That is what the fund is. And our strategies focus on addressing and improving or redesigning community level systems towards equity and justice. So services are a part of that, but it's not just clinical, it's not just a medical model approach, but it's a community approach that we hope to support in the community. The next slide, we'll talk a little bit about social determinants of health. I won't belabor this. I know, especially in these communities, you've heard this before, but we are trying to operationalize what a social determinant of health strategy looks like. And this is really about how we are addressing root causes. The definition that we're working with social determinants of health are the conditions in which people are born, grow, live, work, and age. I also like to add play and pray. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. When you look at our previous initiatives in grant making, traditionally, we've worked with and supported the organizations that have provided needed services, in some cases emergency services in the community. And that will continue to be a critical point for us, critical importance. But there are elements of our initiatives that will build off of that. We realize that we have to do more. It's what we call a yes and approach. Yes to meeting the immediate needs and investing in strategies that impact root causes, that address community systems or system inequities or injustices. This is something that is across all of our strategies. It's not isolated to an equity strategy that's siloed in our work, but it's really across all. And this is really our definition of how we work upstream for the Community Partnership Fund. The next slide is an articulation a bit of our focus on equity. And obviously over the last month and a half, the term equity has been used more frequently. There's an acknowledgement of need to address equity and achieve equity in many systems, not just in regards to criminal justice and justice itself, but across the board. And while our organization has been positioned towards health equity, we realize that it's much more than that. Health equity, and I'll read a little bit of a definition, is the equal opportunity for members of all populations to disease prevention, healthy outcomes, or access to healthcare, regardless of race, gender, nationality, age, ethnicity, sexual orientation, religion, immigration, language, health status, or socioeconomic status. I want to call out, this is also about racial equity and justice and supporting strategies that operationalize investments towards equity. It's not just the statement, it's not just standing and listening, but putting our investments, putting our strategies into practice, operationalizing this equity lens. This is done again by working and looking at systems, creating new systems, system improvements that foster opportunities that lead to equity for all. I'll pass it back to Gabby to talk a little bit about our collaboration.
Thank you for that. And just as we had highlighted, really one of our values is to be very intentional in collaboration. You know, as a funder, we always seek our grantees to do that as well. And we know the challenges of true collaboration. And it's really not just signing off on a proposal and everyone working in silos. And that takes a lot of effort and a lot of commitment. And that is something that we take very seriously. Really looking to develop those relationships with you, with grant makers. As you can see, there's a list of organizations and associations that we seek partnership with and that we also leverage with. And so we have dollars which are very limited in the scheme of things. And so how do we partner and collaborate with others, as Sister Suzanne said, like-minded partners, to seek to work together towards change? Next, please. In addition, in working with the community, one of the philosophies, one of the values that we hold very close to us is meeting the community where they are. And so it's not, as Jason says, coming up with an amazing theory of change or a model that we think should just happen. It's really listening to the communities, having convenings, bringing others to the table, both internally, also within the organization, with our CHI partners, our population health partners, but especially externally, and bringing a wide range of communities to the table. The nonprofit sector, for sure, but also local government, the business sector, other health systems, other funders, to really seek to understand. And part of listening is influences how we develop some of our strategies, our initiatives, and really bringing that to our board and having those honest conversations about, yes, we are a health system and we tend to be very comfortable in the clinical space. And there's a lot of quantitative data that we track, but recognizing that the work in the community is not as simple sometimes, and really looking at those processes and those engagements. And part of that is we've invested as part of the fund with some systems, some organizations, to start developing some of those indicators that really tell us what impact are we having in the community, because we recognize that sometimes we don't have those evidence-based metrics. And so we look to develop those in partnership with all of you to be able to demonstrate impact in the community and balance that with the good work that we do as Providence St. Joseph Health with our healthcare and our clinical work. Next, please. And lastly, it's around innovation. And we really wouldn't be able to do this and take risk if it wasn't for our board. Our board is very committed to listening and to also supporting some of this work. And, you know, looking back at some of the initiatives that Jason will touch on, a lot of them started at the board table talking about, let's try this. Let's see if this works. Let's see what happens. And it's been amazing. It's been amazing impact, amazing results, because our board trusted us and trusted you to engage in this kind of work. And we also look to learning from our engagement, and our work evolves in partnership with all of you. Okay, now Jason will touch a bit more on some of this work and our new focus areas.
So here you see a bit of our 4 focus areas. And for those of you who know us, you know, I think this may be a little bit of a shift, but in reality, it's not. I think our previous initiatives have been focused in these areas. We'll get into that in a bit, but these are the 4 focus areas as we expand the foundation in the future from 2020 and beyond. Not just because we're expanding into places where Providence Health and now Providence St. Joseph Health have a presence, but really this is where we need to go. This is where our board, our leadership feels we need to go after hearing from the community. Capacity building, housing, education, disaster response, and resilience. And looking at these, you may think to yourself or say silently or maybe loudly, aren't you a health foundation? This doesn't sound like health. In our strategy, though, we recognize the intersectionality of these issues, that there's interplay between various issues, and they have impacts on each other and down the line, and downward impacts on health status and health outcomes. Example, housing insecurity. If you're trying to pay the rent every month and you're struggling to pay the rent, or you're under risk of eviction because you've lost your job due to COVID-19, there's a linkage to health outcomes, worse health outcomes. If there's obviously, I think, a link between education attainment and health status in terms of the resources and health coverage you can get, but also within education as an issue, early childhood education, things like restorative justice in schools, a school to prison pipeline. These all have health implications, and they're under the heading of education and disaster response. And I know many of you were at our convening in February. In fact, that was the last outing that we had as a foundation outside of our headquartered community in February, before the COVID-19 restrictions took place. But with disasters often lay disparities or inequities bare, that those who are affected by disasters, in some cases wildfires, and other places earthquakes, floods, or in this large-scale disaster of COVID-19, those groups that are affected the most were already marginalized and were already struggling before the disaster took place. So how do we address it, and how do we work closely with communities for strategies and solutions? This next slide is probably familiar to some of you. I know we have some new folks on the Zoom, but these are our existing grant initiatives: emergency food and shelter, intersections, community building, disaster relief, sustainability initiative, and innovations. There's just words on a page right now, but I think these are within them, there's different strategies here, again, towards achieving equity with a focus on those most in need in communities. Taken together, it's a comprehensive approach to building capacity in our community. I'll point to our emergency food and shelter initiative that seeks to provide resources to organizations that are meeting emergency needs around housing, around food, around care coordination. You take a step beyond that, we have our community building initiative. And I know our initiative lead is on the call also today. But this initiative is about building community leadership. It's about empowering neighborhoods to take control of their own destiny, working to achieve not just additional resources in their community, but working with city council members, working with school board members to articulate community need and have better policies in place. And our intersections initiative. And we have 3 intersections coalitions that are active in Northern California, 1 in each of the service areas here, that are really focused on what does upstream look like? What is an upstream approach to housing, for instance? That is not just about housing the homeless, but it's also the policies in place that can prevent people from becoming homeless in the first place. And how do we work with non-traditional partners, going beyond nonprofits and going beyond health-serving nonprofits to county entities, to the business sector, and working on education and advocacy. These are some of the structures and some of the investments that we've had. But we've also had disaster relief that may have taken the form of a direct grant to meet immediate need. But as I mentioned, now we're looking towards also how do we build preparedness? And I know there's a few folks from the local COADs that are on the call. It's organizational capacity that builds and fosters that community resilience. So go to the next slide. I mentioned our COVID-19 response, and this is something I think when we looked at the beginning of the year, obviously we didn't have this. I think not many of us were thinking about COVID-19 in January. But I think because of our relationship with the health system, we were able to deploy some funding. In the grand scheme of things, not a lot, but some rapid deployment of funds to some organizations in each region. And the regions are not just the 3 in Northern California, but we're looking all across the West Coast, all the way stretching to Alaska, and working with those organizations who will focus on the most in need, the most poor, vulnerable populations to prevent the spread of COVID-19. Our health system continues to do that. But for us at the fund, we've taken the time since then, since March and April, to look at community needs and try to understand where we as a foundation should be. Obviously supporting some of these immediate needs, but also understanding that for a next phase of our COVID-19 response, there's longer ranging implications, that we're not going to go back to where we were, unfortunately, in February, but that COVID and COVID-19 and the impacts it has had on our communities, both human and economic, we'll be dealing with them for the next few years. And so the next phase of work is an acknowledgement of that it's not a quick fix. It's not just here's funding to do screening, but it's much more about what are the necessary structures that need to be in place so that we can tackle COVID-19 and the intersectional issues that are at play to support our communities for the long haul. This is much more in line with what other funders are looking at, but I think with our spin, that it's also acknowledging that there still is immediate need. We don't want to turn our eyes away from that, but also incorporating how are we addressing needs, but having that linked up to longer range systemic strategies. So our next initiative, which I know many folks here on the call may have submitted a letter of introduction for, is our Community Recovery and Resilience Initiative. That initiative LOI period closed last Friday. Within that, it's, again, not just funding services, but how do we strengthen collaboratives who are in this space? How are we working? together. And it's this yes and approach. Yes, this the immediate need, but let's address the root causes as we go along. A little bit about that initiative, and I know that for some folks on the call, you may not have submitted, or some folks did submit, but we've had an overwhelming response to that. And on the one level, I think that's great. I think for us, it's really important for us to learn about the different collaboratives that are in play, that are working in the region. Unfortunately, as a funder, we don't have all the resources to fund every single submission, but I will say that it's valuable for us to learn. At its base, this LOI process was an opportunity for us to learn about your work. And even if certain groups are not selected for funding in this go-around, we now know about you. We want to have phone conversations and hopefully in-person meetings with you, even if you're not funded, to talk about where there might be alignment in other initiatives, in other efforts. This is part of the relationship building of getting to know you better, getting to understand the opportunities, the needs, but also the resources in community. So we go to the next slide. For us, it's not just about funding and resources. Partnership looks different in different ways. Again, we're happy to be up there in February to talk and convene Napa and Sonoma stakeholders around fires and fire recovery and disaster response and resilience. For us, it's about research and field building. What are the best practices out there? What are new practices that we can share? And so supporting convening, supporting conferences, the getting together of folks, sharing information through publications, whether it's through things that we commission directly or through journals that are across the field. These data, the reports, new frameworks, not just for grant makers, but for also the nonprofit sector, government sector. This is part of what it means to work upstream. It's not just about a territory. It's not just about proprietary information, but it's about building the evidence base, creating new evidence. Since evidence base is a buzzword, and you hear a lot of folks and a lot of institutions say, well, we only fund evidence-based solutions. Well, we're here to help create that evidence and work with you to elevate what's community informed to becoming evidence-based recognized across the field, and that can be built upon by others, other funders, other communities, and ourselves. So I do want to take a little time to see if there are questions that have popped up in the poll. Let's see. So there's some questions. One question that came up, I'm an Emergency Food and Shelter Initiative grantee, FC. Will you continue that? Yes, FC will be, there'll be an FC offering that will come out later this year, so look out for that. We realize there's a bit of a transition period for some of our work, some of our initiatives, so we're not closing that initiative for this year. There's a question or a comment about the partnership fund, the St. Joseph Community Partnership Fund. Other folks may know the hospitals directly through community benefit or community health investment. It's part of the Providence St. Joseph Health family, but again, within this, we are an independent grant-making foundation. We don't do fundraising, we do grant-making, and it's strategic grant-making. We work closely with our hospitals and the health system, but I think look at us as another way that resources are deployed that may be aligned with, but oftentimes work outside of the field of community benefit. See if there's a couple quick questions, and we'll have time a little bit during our breakout sessions. We have, through the wonders of technology, we'll have the ability to have breakout sessions where we'll have more conversations and time for us to talk together. question about the phase 1 funding for COVID that was released in March, April. And that was just a rapid release of work, of funding to support work on the ground. And as these questions come up, I do want to offer the ability to have one-on-one conversations. If there's an interest to share your work, or if there's more specific questions about our foundation, we're happy to set those up. We're able to work with your schedule and find a time to connect. So why don't we move into the breakout session? So I do want to bring back Paul. Paul's been our guide here. And again, through the wonders of technology, we're able to have these breakouts. And again, we had hoped to do this in person, but this is just a way for us to learn more about the work that you're doing, the work of the collaboratives that you are engaged in, and hopefully not just learn from you, but learn from each other. In previous sessions where we've done this, there's been a value of having folks in their breakout session connect with each other. Some in close by in the same county, some across different counties, but again, this idea of bringing folks together to learn, to share, and build all together. So I'll turn it back to Paul.
Thank you, Jason. So in about a minute, you are going to automatically be moved to one of 4 breakout rooms, as Jason says, through the magic of technology and Zoom. So the breakout groups will have about 25 people because we have over 100 people in the room. Each group will have a facilitator as well as a St. Joseph Fund, Community Partnership Fund staffer. So the facilitator is going to walk you through 3 questions, 2 of which are on the screen right now. The first question is just, we're going to ask you to introduce yourself and what your organization is and what they do. And we're going to ask you to do that in the chat, again, with 25 people in the room. We unfortunately don't have time to go around. But then the next 2 questions are going to be discussed verbally. So the second question is, what collaboratives are you involved in or know about in your area? And to be clear, we're not asking you about how you formally collaborate with partners. We know you're all doing that. And again, if we spent time on that, it would take the whole breakout room. But more the actual formal collaboratives of organizations that come together and meet in person, virtually, and such. And it can be just a quick name of that. And we're hoping that, as Jason says in that, you may be naming things in your own community that other people in the room don't know about. And then the third question is that we're going to ask you to dream big. If you're familiar with the concept of BHAG's, Big, Hairy, Audacious Goals, if you had a magic wand, what major change would you make in your community to have the most impact? So this is a fun chance to kind of dream big. So you will have until 11:10 to discuss this. Everybody will get a 1-minute warning broadcast to them over the chat, and then at 11:10 we're going to close the rooms, and you have 30 seconds to leave your room. Otherwise, you'll be moved automatically back to the other room. So enjoy, and we will see you all back here again at 11:10. All right, so we are going to give just a few more seconds for everybody to get back and get organized, and then we'll do report outs. All right, so we're going to now just have a brief report out from each of our facilitators, and we will go in the order of Haley, Marilyn, Carrie, and then myself. So Haley, please start us off.
Okay, unmuting, so sorry. Thank you. We had a nice chat about a lot of collaboratives, and so thank you for sharing all of that. And our BHAGs, stable housing for all was very, very prominent as a topic, providing stable housing for all, and there's details that were shared on certain projects that were very promising, so thank you for sharing those. Quality childcare for all, and you know, the pandemic has shown that childcare in general is no longer a women's issue as it may have been perceived as in the past, and it's becoming much more clear that it's a very important issue for the community. We had a nice conversation that could have gone a lot deeper, I'm sure, about addressing systemic racism, keeping it in the conversation, reckoning with it, making sure that ensuring that people of color have access to executive leadership roles in local nonprofits. And so that is, you know, major focus, and it kind of goes across everything, every structure. The issue of providing all-encompassing services for the older population, but specifically and most importantly for those who are low income, and I presume of racial and ethnic, I don't know if I want to say minorities, but people of color, because those individuals, especially low income, and I presume people of color, do not have access to those services in the older population and people with dementia. So having that, and let's see what I've left out: food security, climate change action, achieving those and making sure that that is woven into all of the community's activities, and providing all-encompassing services for family resilience and family stability. So mental health, regular health, childcare, everything. And we had a very, very active chat. So we have a lot more detail to share to the group internally as well. Thank you.
Okay, to add to what Haley said, our group also had a lively conversation. A lot of what was talked about was this idea of individuals who are, you know, maybe in limbo, who have just been released from medical care, or maybe don't need to be in a hospital, but still need to get quality medical attention. So those between hospital care and being at home, there's just not enough support for that in terms of whether it's housing, for those who are being released from hospital, or, you know, just in general. We also talked a little bit about the fact that while there's been a decrease in homeless youth, there's still a lot of need to help that population in terms of youth shelters, affordable housing. We also had some conversations surrounding mental health services, in particular support for maybe also those cases who are not severe enough to be needing hospitalization, but kind of being able to step in and intervene so that it doesn't get to that point. And then let's see what else. We had a lot of talk about food services as well. We had, you know, someone shared their email address and phone number so that they can, you know, collaborate more on those things. And upstream programs and services for parents and children was also mentioned, but it was a great conversation. I also noticed some overlap from previous breakouts, which was interesting. That was the first time that we had some, you know, considerable overlap between a different breakout and then today. So thank you all for your thoughts. We also have an extensive chat, so I'll be sharing that as well. Thank you.
Okay, and in our breakout group, of course, there were some overlapping themes with some that have already been mentioned. Our group is also very sort of focused on the biggest things that without which nothing else will really change. So of course, economic inequality, how do we create economic equity? How do we deal with multi-generational poverty and all of the impacts of that? How do we end poverty? We also had several people talk about affordable housing, that being a cornerstone to every other kind of wellness and success and health. Also, how do you really bring not just patients in the community to the table, but really bring them to the table in a way that matters, asking individuals and their families what matters most to you, and really engage that voice and leverage that voice. Also, how do you create access to educational, professional education in fields that actually make enough money to make it be viable opportunities for people that don't usually have access to those opportunities, have it available to all, especially in really vulnerable communities such as the tribes, and ensure that people have that longevity of work and success. Governance, how do you ensure improving good governance measures? How do you introduce those? District-based elections, vote by mail, improve people's civic ability to engage. More affordable housing. And just as a sort of a broader issue, just how do you create a safety net for vulnerable communities where they're one paycheck away from losing their homes and not having access to food, and now, of course, with children not in school, everything is even more dire. And then last but certainly not least, how do you ensure that all of these big systems, government, education, housing, how do we get all of these big systems to sit together and create these solutions collaboratively? So those were the big ones for our group.
All right, so I get to go last, and several of the things that we discussed were already raised, but I'll go quickly. Addressing and treating trauma, both for children and adults, was a big one. Helping and build understanding and partnership with businesses. And then housing and providing secure sites that provide stability, the ability to deal with hygiene issues, as well as some other areas such as trauma. Addressing inequities through the genuine involvement of residents in our participatory processes and the structure of power. One specific to Humboldt, building up the collaborative structure and the emergency response template that allows for coordination of food services being delivered. Increasing language access across the board. And then finally, removing egos from politicians and helping them all work together. So again, we also had an extensive chat room, which I think there are probably ideas in the chat which I didn't capture, but they will be captured after the event. So thank you everybody for participating in those breakout groups, and I'm going to hand it back to Jason and Gabby to close.
Yeah, well, thank you everyone. I was in Carrie's group, and I shared that that's really how we begin our journey in developing initiatives, is really being at the table. And thank you for sharing your dreams and sharing about the collaboratives. Always inspiring to see the commitment that all of you have in the communities. Just want to share with you a bit about what are the next steps, what's happening. And as we move forward together, which is the theme of today, we will enter as part of phase 2 in identifying and selecting grantees for the Community Recovery and Resilience Initiative that we talked about. We will continue to identify ways to reach out to you to continue learning about your communities. And really that will help us in implementing our strategies to support within our focus areas and support all of the regions within Providence St. Joseph Health. I know there's been questions in the next slide, please, about, will we be sharing today's conversation? The conversations were recorded, so you can find them, access them in about a week on the website. You can see the address there below. And as Jason mentioned, any questions, if you'd like to connect with us, please email us to the email communitypartnershipfund@stjo.org so that we can continue this conversation. And so please be, reviewing the website when you can, and we'll be working very closely with Dana and Dan and Martha, and letting you know what the next steps are and how we will continue to engage with all of you. Jason, anything else you'd like to add?
Just a clarification, the breakout sessions will not be posted, so don't worry about that.
Thank you for
but
that.
the general slides if you want to compare and contrast the Washington State one, the Southern California one, you'll find out we're not really reading off a script. So it's a little more specific. Yeah, I think there's been interest. Certainly, whether you already know us and just want to re-engage or are completely new and have questions about the fund or want to share your work, please email us here at this address. We'll set something up in the near future to continue the conversation. And again, it's a relationship. We want to be there with you.
Okay, well, thank you again, and we hope you have a good rest of the week. And thank you again, Dana, for opening us up, and hope you all have a good day. And we'll hopefully connect soon. Thank you. Bye-bye.